All right. Good evening, everyone. It's our great pleasure to invite Dr. R. Srinivasa Murthy today evening. Before I introduce Dr. Murthy, let me tell you briefly about our organization, Citizens for Inclusive Living Society, Chandigarh. We are a registered society working for the welfare and dignity of persons with mental and intellectual disabilities in Chandigarh for the last 4 years. We began as a loose association of families and professionals in 2020. 2 years later, we registered it as a society with almost a single focus on persuading, cajoling, forcing the Chandigarh administration to set up a group home for persons with mental and intellectual disabilities, a residential rehabilitation facility. After a lot of struggle, we were finally successful, and Chandigarh administration has built a very good group home in Chandigarh. We are now on to part 2 of the struggle, that the funding and the management of the group home. So our struggles are not over yet. They are continuing. We also work very closely with a lot of families and individuals, creating peer support groups, family support groups, having some awareness programs for them, requesting them to make their voice heard to the authorities, verbalize their needs, get together and act rather than sit and cry in their homes, get together and act. So it is in that light that we are very fortunate to have Dr. Murthy here talk to us today evening. I have known Dr. Murthy now for close to 2.5 decades, off and on. In between, we lost contact and then again had contact. Dr. Murthy is a distinguished professional. He did his medicine degree at CMC Vellore and then did his post-graduation from PGI Chandigarh. So that's his connection to Chandigarh. For more than 2 decades, he was a faculty member at NIMHANS, Bangalore. He has also worked with WHO, World Health Organization, as a staff member. And now, post-retirement, Dr. Murthy is perhaps even more active, writing books, giving talks, reaching out to families, and helping them in as many ways as possible. Before I hand over to Dr. Murthy, and before Dr. Murthy starts his presentation, he has requested that we play a small video. So we would play a small video and then over to Dr. Murthy. Dr. Murthy is after Dr. Murthy's presentation, and as long as the presentation goes on, we would, put the participants on mute, and after that, we'll have an interactive discussion. Without further ado, I'll share the screen and share the video with you. Share screen.
I keep quoting my father all the time, and I'm sure I've done this millions of times. One of the first things he taught me was, man ka ho to acha, na ho to zyada acha. If things happen according to how you wish, that's good. But if they don't, that's even better. And I could never understand that. And when I asked him, he said, if they're not happening according to your wish, they're happening according to the wish of some divine force. And that divine force will never think ill about you. So you have to respect that as being better. The other thing he told me was, when I was struggling a lot in those times, I said, bada sangharsh hai jeevan mein. So he said, jab tak jeevan hai, tab tak sangharsh hai. I used to tell him, that life is a struggle. And he used to say, so long as there is life, there is going to be struggle. I think if we accept this factor, your life is never going to be easy. Something or the other is going to happen. So rather than sit in some kind of despondency on that, be aware that tomorrow is another challenge, is another day, which could turn out to be profitable, which may not. But eventually there will be another day when you can start trying all over again.
Thank you very much, Aditya. It's good evening to each one of you. That's a fantastic way of starting off the session today, both the challenges and opportunities for growth. And in the next 35 minutes, I would address caregiving as a challenge. More than that, specifically look at caregiving in terms of finding purpose, not all aspects of caregiving, and why purpose is important, both for the caregiver as well as for the person with mental illness or disability. And lastly, instead of saying that find a purpose, outline for you or the group about 10 things which we can do, not a prescription, but a practice of finding purpose based on literature and experience. I would choose to tell you many things in the form of stories rather than any slides and data. I'll tell you little stories to make the point that I'm making. Before I go further, I want to really congratulate the group led by Aditya and Simi Varyak and Adarsh Kohli, Nitin Gupta and Suman Gupta and others for the very important initiative of Citizens for Inclusive Living. It will be historically when Dorothea Linde Dix started the mental hospital movement. She started with the idea saying that mentally ill should not be at home, they should be in asylums. At that time, that was a very progressive thought. Today, they have to be living in the community, and I congratulate Chandigarh group. Especially, you have shown the light for rest of India, how you can push government to take responsibility for a group of people who are easily forgotten. For me, this is very close because I started my career in CMC Vellore, as Aditya mentioned it, and CMC started one of the first family-based care centers in 1957. I quote from the foundation thought, we would be including the family as much as possible in understanding and care of patients. 1957 was a time when the rest of the world was thinking of the family as toxic. So we in India have a tradition of thinking of family as an important part of our life. I'll come to that in a minute. Before I go a little further, I want to recall and pay respects to a recently passed away colleague who was a leader, Devraj Gowda, who was the president of AMENT in Bangalore, just happened about a few days back, and his contribution is very, very remarkable. For me, Chandigarh is like second home. You don't lose any opportunity to get back, because when I moved from Bangalore to Chandigarh, it was a culture shock. The Punjabi culture of bonhomie, excitement and opportunism was in contrast to a very traditional South Indian person. And I became a person what I am because of Chandigarh. And that is finding a purpose and a meaning for my life for the next 50 years. One of the ideas that I learned during that time was this idea from Sikhism called Chardi Kala, which essentially refers to finding meaning, purpose, and resilience in adversity, which Sikhism and Punjabis represent very well. So the topic that we are talking about is very much similar, linked up with all the things that have happened. Now, the idea that caregiving is challenging doesn't require me to say it. It is too well known. But very interestingly, the two articles that came out today, one in the British Journal of Psychiatry, British Medical Psychiatry, where they talked about the problems in Japan, caregiving, and said it's a significant problem. The second one was World Social Psychiatry, a paper from Odisha, where they studied 60 caregivers and said caregivers have a lot of emotional problems and we should be taking care of it. But in Chandigarh, this work started in 1980s, a little earlier than 80s, 75, when Dr. Wig was the head of the department. He was a visionary. What happened was that we were doing a study of introducing the long-acting drug called enanthate or modicate, as we call it now. That's once in 15 days, once in a month injection. When that study, the clinical trial came, we said we'll do it in a different manner. We will study the needs of the families in the community and then think of the role of the drug. And Dr. Suman, who was the leader, a nurse, Baldev, they did it. And in that paper, which we published in 1980, what we found was that families had financial problems, they had marital disturbances, excessive emotional involvement, high expectations from the person, problems of employment, and problems of getting long-term care. We developed some interventions and provided help to them. Unfortunately, Dr. Vig left for Delhi, I left for Bangalore, and nothing really happened at the community level till Dr. Chavan came in the late 2000 and started a fantastic home care program. We'll talk about that in a minute. But this idea of the importance of the family was very close to my teacher, Dr. Vig, who wrote in Tribune in 2001 that taking care to the mentally ill, the importance of the families. So that's what we are talking about today. You might ask, what is so special about the family? You know, no other country, particularly the Western country, has this tradition of families taking care of mentally ill. Let me just give you two small facts without overburdening you. For example, at the time of independence, when we had 300 to 400 million population, we had just 10,000 psychiatric beds. On the other hand, at that time in England, with 1/10 of the population, they had 150,000. That means they had 150 times more mentally ill people in the institutions compared to India, because there were no families. Much more important, just about a year back, a book by the NIMH director came showing when the mental hospitals were closed, the prisons population of mentally ill increased, saying that the families were not there to take care of these people. So we in India have a special tradition of providing care, and I am not only glorifying it, I am saying it as an important model for rest of the world to follow in this area. But let me quickly say, there are large number of studies to say caregivers are a very burdened, depressed, distressed. As Ritu Sharma from Delhi just wrote to me yesterday, I feel after many years of caring for persons with mental illness, at least one or two family members, especially siblings and the primary carer, go through anxiety, depression. How much ever you try to avoid this happens. I overcame my anxiety by following measures, and hopefully she's in the audience and she will tell us what she did. Otherwise, I'll come back to talk about it in the discussion steps. Why is it important to develop purpose? There are two reasons for it, sorry. One is it is good for the person who is a caregiver. Second is good for the person whom you are caring, that is the person with mental illness. Let me talk about the good for the person with a caregiver first. At this moment in the world, in terms of longevity, in terms of chronic illnesses, in terms of recovery from chronic illnesses, in terms of quality of life, purpose of life is recognized as very important. It came up in a big way in the Western world when during the concentration camp, the people who purpose of life were found to be able to handle the concentration camp better than others, and you know about it very well, called logotherapy. But much more than that, in the last 10 years, there are more than 10,000 articles relating to purpose of life. 5 benefits are available to each one of us by developing a purpose of life. Immediately, you'll ask me, what is the purpose of life? Purpose of life is the extent to which each one of us feel that our lives are characterized by meaningful purpose and direction. The more we recognize that our life is directed and meaningful, the longer we live, and other things I'll tell you. Now, you might ask, how do we know that this works, Dr. Murthy? There are a large number of longitudinal studies of people from young age till late, some of them up 75 years old, like the Harvard study. And they included about 10 years back to see those who had a purpose of life made a difference or not. And each one of them found that those who had high purpose of life in the ranking using a tool had 10 years longer life than others. You might ask, how does this happen? One example I will give you of the Nobel laureate Blackburn. She discovered age-related chromosomal changes called telomerase. This is at the end of the chromosomes. When she discovered that this is related to the aging process, a colleague came and said, look, I want to study caregivers, see whether it makes a difference. And they found that caregivers generally age faster, and this was reflected in the changes in the chromosome. Now, there was a twist to the tale. There were some caregivers who were not showing that effect. And when they went back and studied, they found that these people had more positive attitude towards caregiving. They had a purpose of life, and they did meditation as part of their caregiving experience. And then they found that to be protective. Now, the second set of studies relates to the chronic illnesses. Generally, all chronic illnesses are less in those people who have a purpose of life. Let me just give you one other story that came up a few months back in the Journal of American Medical Association. They were studying one of these long stay groups. 10 years back, they added the dimension of gratitude. And they rated them as high in gratitude, low in gratitude, middle in gratitude. And when they followed them up for 10 years, they found that those who had high in gratitude had 10% less cardiac problems compared to those who had low gratitude. This 10% is almost equivalent to the benefit that you get by taking statins every day. Just imagine it. If it was a drug, people would have gone and patented it and distributed it to all of us. And this type of a indication of less of the problems, cardiac problem, diabetes, all these things are there. Much more important is the evidence of people living with chronic illnesses, diabetes, hypertension, cancer, HIV, all of these things. When the person who is having this illness has a purpose of life as a component of their approach to their life situation, they have better adherence to drugs, decreased side effects of the drugs, better quality of life, and much more important, much less suicidal ideas, much less anxiety and depression. It's almost to the extent that people, as I said, Ritu Sharma will come and describe to her how she used her spirituality to handle the stress of it. Other important very aspect of caregiving, I mean caregivers' purpose of life is that they have a better quality of life. When you measure using the WHO quality of life measure, they have a better quality of life, greater satisfaction. And as I said, to summarize, they live longer, they have less chronic illnesses. If they have chronic illness or a surgery, they recover faster and they have better quality of life. So irrespective of being a caregiver or not, having a purpose of life is very important. And that is what I discovered when I worked in Chandigarh for 10 years for me, which has kept me going in spite of two major illnesses that I carry with me, diabetes and cancer, for the last 11 years. Now, you will ask me, how does this relate to caregiving? You know, if you ask me, the biggest change that has occurred in my professional career time in the last 50 years is the change from thinking that we cannot do anything for the persons with mental illness to recognizing there are lots of things that can be done for the severe mentally ill people. For example, in 1972 to 75, when I was doing my psychiatry training, we had only handful of drugs like chlorpromazine, escazine and others, and we did not recognize any other possible psychosocial interventions. Then came in the 1970s a major breakthrough about caregiving. What happened was that they were looking at people who are on maintenance drugs for schizophrenia, Dr. Leff and his colleagues. They found that some families were having relapses while others were not having relapses. They wondered why. Why is the drug not working? Then they systematically, like the British scientists, they studied them and came up with an idea called expressed emotions. Chandigarh was one of the centers subsequently where research was done. Essentially, what they found was there were positive contributions of caregiving and negative contribution. Positive one is acceptance and non over expectation, and negative ones are critical comments, rejection, and over expectation and things like that. And this is an area, and they found that those who had high critical comments or rejection or over involvement did poorly in terms of the relapses and hospitalization. So much so they developed an intervention to decrease the expressed emotion. Interesting part of it is that when the study was done in London, Aarhus, that's Denmark, and Chandigarh, Chandigarh had the lowest expressed emotions, and they linked it to the better outcome of schizophrenia in India for this observation. Now, the other thing that I want to talk about it is the new therapy called avatar therapy, where you can literally teach people to control their hallucinations by using information technology. And I'll be glad to talk about it or another thing. To say, similarly, there is a lifestyle shown exercise, sleep, nutrition are important for recovery, as important as the drugs for some of the patients, and social skills training is very important. Now, what I have presented as the advances in extremely brief manner is that as a caregiver, what you do, how you look at your person with mental illness, positively, actively, involve the person in lifestyle changes, involve the person in social skills, that would be good for the person. Now, the question that comes up is, Dr. Murthy, how do I put it into practice, this idea of purpose of life? Is it something which you can prescribe? No, it is not a prescription, it is a practice. And I would delve into it one by one in our 10 items that I would like to share. Not necessarily in any order of priority. You can choose all the 10 or only some of them. And the written aspect of it, as well as the background documents and the tools for all of it, will be available to you in the Citizens for Inclusive Living website. Please, so don't feel bad that I'm going through it in a very fast manner, because I want to finish it in another 10 minutes quickly. The first and foremost important thing is that we must think of the self-care of the caregiver. You might ask me, why are you starting with the self-care of the caregiver? Because for the person with the mental illness, the most important thing that can happen is for the caregiver to live as long as possible. Now, how do you live as long as possible when, particularly when you say there is so much of illness and chronic illnesses and all these things are there, is to develop the techniques of self-care. Very interestingly, the Harvard has a book on self-care which describes it. We in India developed this module. Again, it's available to you in the website of the Citizens for Living, where we have identified 5 things each one of us can do: daily exercise, sleeping for 8 hours, nutrition changes, meditation, and being connected. Each one of them we have developed in this book. What is it? Why, how, and examples of people who have done it. It's a very important one. Similarly, when you have distress, what you can do about it by sharing of experiences, journaling, listening to music, or spirituality. Each one of them is developed. We developed it for special children. It's applicable to you and to ordinary normals also. So make it a point to relook at your current life situation and think of developing self-care, both for yourself as well as the person with mental illness, disability, or chronic illness, or even for the general population. The second important one is to find because illness is a long-standing one. If possible, try to find one team which will support you through your journey. And I'm glad to say that I'm sure there are in the audience, there are at least a handful of families whom I continue to be in contact even after 40 years and support them from my contact of days of Chandigarh in 1972 to 82. So try to have a team which will help you so that you can go to them who know your background, your things, and help you. The third one, before I come to the more specific interventions, find a person, a very good friend a family member, or a colleague with whom you can let your emotions down. This will be needed either because of the illness itself, or because of the community's reactions, or your own personal distress, and build this one into your coping strategy, because the journey is a lonely journey and you cannot do that without this particular one. Now I come to the specific ones. Each person, as I said, the way you react, the way you structure the life of the person, the way you teach the person to control his symptoms are all possible today. So what you need to do is to acquire the skills from the professional team. How can I, Srinivasa Murthy, take care of my son Raju with the XYZ problem, because he has this type of a symptom, or this type of a behavior problem, this type of a negative symptom? Ask the team, learn the things, and become the second therapist for the person. So acquire clinic skills of caring as an important aspect of finding a purpose. Now I have told you so many things, you will wonder you still have not given us anything more than generalities. The idea of the people writing about their illness experience is very new to India. The first book came up in 2008. Amandip Sandhu from Chandigarh, who used to live in Rourkela, wrote this book, Sepia Leaves. Subsequently, lots of books have come up. This book, Book of Light by Pinto, contains about 20 stories of caregivers in India, which is there. And as I said, the Harvard has a handbook for the caregivers. And Amrit Bakshiji from Pune has done a fantastic job of not only talking about his experience in the Reader's Digest March 2002, which is a brilliant article, and much more than that. He has brought together a caregiver's handbook and also a book of about 25 stories, to which we have given a summary article from my team from Bangalore. So you have a lot of material available about this. And one of the things that each one of us can do is what is called as journaling. Journaling, without exaggeration, is as good as going to a psychiatrist, psychologist, counselor, or any other therapist. Every day, if you can sit down and write for 15 to 20 minutes, is as good as talking to a psychiatrist, psychologist, or a counselor. And three things will happen. First and foremost, it's evidence proven that your distress becomes minimized or disappears. Secondly, you will have something to look at when from time to time to see what you have gone through. Much more important than that, when you write it as the Bakshiji's book, other people will be empowered by reading about you and feel excited about it. Let me just tell you about a colleague of mine from Vellore days, from my undergraduate days, who had a child with severe disability, had this to say, wrote her story and published it as article in Dharma Deepika in 2016. I'll read out a little bit of it to make the point how journaling can help. We had started a journey into a world of unknown. The world of disability is a deep, dark pit of foggy impressions until it comes to you and you are still in a fog. You need help, wisdom, and above all, light from heaven to move from fear and imaginations to faith. Incidents and how Bible and faith strengthen the family as written in this brilliant article, and which inspire other people who read it. To care for a person with disability, there needs to be a transitioning of the mind that comes from the heart. Now, this transitioning of the heart can come from one very big resource that we have, that is spirituality. I especially want to refer to the very important book by Dalai Lama called The Book of Joy. This book contains 10 methods that we can use it for overcoming, finding a purpose, finding happiness, and overcoming distress in many ways. Time doesn't allow me to go each one of them. It could be acceptance, it could be forgiveness, it could be gratitude, it could be compassion. Each one of them, there is a description, there is a scientific basis, there is a practice experiences in this book. And there are many other books which get hold of it, choose any one of them, particularly if you can use the acceptance as well as forgiveness and gratitude. The evidence is fantastic. For example, just recently, last month, there is a paper where they took people who had gratitude, and they found that these gratitude, people who had gratitude had a longer life than compared to those who did not have gratitude. So it is very possible, and this is available to each one of us. I'm coming to near the end of it. The other thing that we need to do is that we need to think of caregiving as a journey, not a destination. I'm making this point again and again because very often when you come to us as psychiatrists or psychologists or something, you say, "Doctor, tell me what I should do." What I say is that, look, think of it as a lifetime commitment, which, as I said, it comes naturally to Indian families. Think of it as a journey for growth and development, both for the ill family member as well as your personal life. I've given you enough examples, and I'll end up by quoting one other example from our work. Two of my colleagues who are there in the audience might come in and talk about it. This parent said, "I think this was all God's plan, because every day I used to pray when I was in the joint family that I needed peace from all these problems. Why are there so many difficulties for me? Now I think God gave me an answer by coming out of the house. He gave me relief. I think your special child is a God gift and gave us because he knows that we have enough strength to take care. And I think because it is God gift, we need to take care of him and all the love and joy." We also brought together another book of 30 stories of caregivers. Again, this is available in the website of Citizens for Inclusive Living, which I have mentioned about it. I am coming to the end of my presentation. I want to say that please remember, caregiving by Indian families is a unique experience not available to the Western world for various historical reasons. If we can document it, describe it, and show it to the world, this is possible, this is happening, and this is good for the person with mental illness as well as the caregivers. This could be the biggest contribution. Like I told you, in Vellore, for the last 70 years, they have a family member always living with the patient as part of the treatment. Vidyasagar did it in Amritsar. I can talk about it in again and again. So we have an opportunity as a caregiver to make a difference to yourself, to have a better quality of life, better satisfaction, and to your person with mental illness to give the better outcome and recovery by using purpose as an important part of it. I know purpose is only one of the 10 or so skills that you need as caregiving. Hopefully, in course of time, we will touch upon that. Today, we will focus upon finding a purpose. And what I would request the participants, I see that more than 60 people are there, to share their experiences, share how they have found a purpose and a meaning in their work. Again, thank Citizens for Inclusive Living for this wonderful opportunity. And as a special gesture from my side, as a sincerity, I am available to you. You see in the chat box my email. Please write to me. I do only voluntary work, and I am available to you as a resource to find purpose in your life as part of caregiving. Thank you very much. Thank you, Aditya.
Thank you so much, Dr. Murthy. Thank you so much. So people have already asked for recording. This is being recorded and this will be put on the website. We've been a little slow. In the chat box, I will also share our email address. And if people want some particular resources, we'll also share it on the website. But if someone wants a copy of it, Dr. Murthy has already shared with me and I'll be happy to share it with you. Before we get into question and answers, Dr. Murthy had suggested that some of the people in the audience may want to share their experiences. I will say the names, and if some of them want to, please let us know. We will. Mr. Amendra Kumar has raised his hand, but I would request you to just hold on for a while. We'll see if these people want to share their experiences, and then we'll open it up for a more general discussion. Miss Anu Kapani, Miss Divya, Miss Nishchita, Miss Saraswati, and Miss Ritu Sharma. If any of you are there and would like to share, please just sort of raise your hand and we'll know. And participants.
Namaskar, sir.
So Ritu
Namaskar,
Sharma is
Murthy,
there.
Ritu Sharma.
Yes,
Yeah, Ritu
Ritu ji,
Sharma
please
here.
go on.
Yeah, so thankful for this opportunity. So I would like to share, I've been a carer for the past nearly now 37 to 38 years for my sister. Actually, my primary carer for her was my mother, who's no more. So at present, I am her primary carer. So I just want to share that during this journey, we were very young when all this started, and it was naturally extremely new and difficult for us. So in midway, I would just like to share that I also developed severe anxiety issues as a young person, and then I I was very afraid that I should not go that way what my sister went, and for that I did everything to overcome this anxiety. So I tried my level best by seeking help first, and I was helped by so many people, of course, a psychiatrist, therapists, and my family. For that matter, my mother-in-law, my mother, all have contributed in giving me lot of courage and this lot of courage and strength to help me bail through this anxiety. And at present, by God's grace, I am happy to convey this to you that I am absolutely touchwood courageous and happy with my sister along, and quite evolved at present, but of course not very. Still what you say, I wouldn't call this problem as it can be easily evolved. I mean, a family member cannot evolve so easily. That's what I say. It's too severe. It is too severe for anybody to find any positive sort of a strength out of it, but still there is one God Almighty that gives something in you that will help you to bail through all this. So with me, it was like my spirituality. I practice Buddhism also. I'm not propagating any Hinduism or Buddhism or anything, but these are the things which helped me to overcome. Some mantras which my mother told me about, Devi mantras, and my this Hanuman Chalisa, and the Hanuman Chalisa, and one more thing, yeah, Gayatri mantra. These were the three mantras which helped me, and also this lot of friends advise of becoming active, not sitting in the place where you feel lonely, sad. You have to become active. Go for morning walks, especially when you are in anxiety and into depression due to anything. So you cannot sit in the four walls of a room and think, and though your body gives away because you are so tired of the anxiety and depression, but you have to get up and get going, go for a walk, do something active, go do something which you like, and that's how you overcome. And all these together helped me overcome 11-year-old anxiety. Yeah, thank you so much.
Thank you.
Yeah. Mm-hmm.
Thank you, Rituji, for sharing. I would just ask once again before coming to people who've raised their hands, if Miss Divya, Miss Nishchita,
Rajeshwari ji is
or Miss
raising her hand.
Saraswati.
Yeah.
She wants to speak.
Yes, please do, madam.
Rajeshwari.
हेलो नमस्कार मैं राजेश्वरी आई एम ए कैरर फॉर माय डॉटर। अभी मैं हिंदी में बोलूंगी। अभी सब लोग बोल रहे हैं ठीक नहीं हो रहा है, प्रॉब्लम आ रहा है, क्राइसिस आ रहा है। तो मेरे पॉइंट ऑफ व्यू से मैं भी कम से कम 20-30 साल से इसको प्रॉब्लम थी। अब बिल्कुल ही ठीक है। हमने किसी होम में नहीं भेजा, वो घर पर ही रहती है, घर का काम भी करती है। तो मेरे पॉइंट ऑफ व्यू से ये है कि सभी को जो है मेडिसिन के साथ जो है डे केयर सेंटर में जाना चाहिए। घर से बाहर निकलने का तरीका है, ये तो सब हमारे हाथ में है। पूछ पूछ के जहाँ भी डे केयर सेंटर हो तो उसमें ऐसा है कि बच्चों को जो है एक तो रेगुलर सिस्टमेटिक बाहर निकलने का हाइजीन इंप्रूव हो जाती है, सोशल इंटरेक्शन हो जाती है, और रेगुलर काउंसलिंग एंड स्किल वर्क ऑल्सो। उससे क्या हो। हाँ
राजेश्वरी
जी।
जी, सॉरी फॉर इंटरप्टिंग यू। हम आज पर्पस ऑफ लाइफ पिकअप करने का बात कर रहे हैं, नॉट द होल केयर गिविंग। हम चाहते हैं कि आपसे, मैं आपको साथ शेयर किया हूं, आप कह सकते हैं कि कैसे आप इसको चूज किया, ये पर्पस कैसे आपका मन में आया और इसको कैसे आप लागू कर रहे हैं।
पर्पस इसीलिए मन में आया था। तो लोग लोग बाग जो है इसके एक दूसरे की शेयरिंग नहीं करते, बाहर नहीं आते, समझ नहीं आ रहा है। तो ये जो बैरियर जो है इसको तोड़ने के लिए ही हमने अपने बच्चों को तैयार भी किया है, विद द सपोर्ट ऑफ माय फैमिली, सपोर्ट ऑफ द डॉक्टर्स एंड सपोर्ट ऑफ द सोसाइटी आल्सो। उससे क्या हुआ है कि जो जो मैंने सीखा है, जिससे हमारा बच्चा ठीक हो गया है, तो हम सब बच्चों को भी छोटा छोटा सा टिप्स देते हैं। कभी कभी डॉक्टर्स भी हमारे पास भेज देते हैं कि मेडिसिन के साथ मैडम टिप्स देती थी। टिप्स इन द सेंस हम ज्यादा बड़ा बड़ा बात नहीं करते हैं, छोटा सा काम कराइए इनको और छोटा सा अप्रिसिएशन दे दो। अप्रिसिएशन भी मैं कहती हूँ कोई ऐसा नहीं पैसे वैसे देना है। अब छोटा सा उसको जो पसंद है खाने का, मीठा बना दीजिए, उसके लिए कोई ड्रेस मटेरियल ऑलरेडी लेके रखो, उसको दे दो। उससे क्या हो जाता है कि जो बच्चे जो हैं उनके अच्छी सी मोटिवेशन मिल जाती है और ज्यादा से ज्यादा काम करना शुरू कर देते हैं। और मैं कहती हूँ इनके साथ आर्ग्यूमेंट नहीं करना चाहिए, नो कंपैरिजन। और साथ में ऐसा है कि आप जितना लव एंड अफेक्शन इनको दोगे, क्योंकि मैं मानती हूँ हमारा एज ज्यादा हो गया, हमारे अंदर पेशेंस नहीं है, मगर पेशेंस रखना पड़ेगा इन बच्चों के साथ जितना लव एंड अफेक्शन दोगे। और मेरी मदर जो है ये जब इसका इलनेस था तब भी सब जगह ले जाती थी, फंक्शन और दूसरे जगह पर। इसको घर में नहीं बिठाते थे लोग बाग, तो अपने हॉल में भी बच्चों को एंट्री नहीं देते, वेरस ये तो सब जगह आके बैठ जाती थी। इनिशियली इसको 80% डिसेबिलिटी था, तो हमने कम करा के अपने बलबूते पर, मेरी मदर की सपोर्ट पर और डॉक्टर्स के सपोर्ट पर, मैंने तो अब इसका बेंचमार्क डिसेबिलिटी है। और ये खुद ही इसने कंप्यूटर वगैरह सीखा है और ये खुद पेशेंट लेके आती है। मम्मी ही और शी इज मर्मरिंग सिटिंग अलोन इन द पार्क। तो कह देती है कि मेरी मम्मी से मिल लो, टेक काउंसलिंग करके। तो मेरा कहने का मतलब है अगर कोई भी कैरियर जो है इन पॉइंट्स को अगर फॉलो करे ना, कोई बड़ी बात नहीं है। और लोग कहते हैं खाना नहीं बना सकते, चाय नहीं बना सकते, सब बना सकते हैं। आज तो हमें शुरू में हम कहते हैं वी आर नॉट अलोन, बाद में कहते हैं व्हाट आफ्टर मी। व्हाट आफ्टर मी का जो प्रॉब्लम है उसको खत्म करने के लिए आप अभी से ही उसको सब काम क्यों नहीं कराते। कराने से जो है ये जो मैं आपको बता रही हूँ, हमारे जो डे केयर सेंटर में कुछ ऐसे ऐसे टिप्स हमें सिखाए थे जो हमने फॉलो किया है, और हमारा बच्चा रेगुलर उसको फॉलो कर रही है। और मैं भी कभी मीटिंग वगैरह में बाहर आ जाती हूँ, कॉन्फ्रेंस वगैरह में, तो शी इंडिपेंडेंटली लिव इन द हाउस एंड आई एम हैविंग द फुल कॉन्फिडेंस। मेरे पास मुझे कोई
राजेश्वरी
खतरा
जी,
नहीं है।
थैंक यू वेरी मच, थैंक यू वेरी मच। और लोग भी है, आप
हाँ हाँ।
ज्यादा केयर, आप
ओके।
केयर के बारे में कर रहे हैं, हम केयर गिविंग के बारे में कर रहे हैं। थैंक यू वेरी मच, थैंक यू।
थैंक यू जी, थैंक यू।
Aditya, can you ask Raminder? Raminder is a very famous child writer, and he would, and also, he will tell you about his own personal journey.
Yes, Ramendra ji, please.
Yeah, Thank you. Namaskara, Dr. Murthy. Thanks so much for a very engaging and insightful talk, as always, filled with very pragmatic advice. Now, I'm a cancer warrior, and I also suffer from certain psychiatric issues. So, my question is that it is regarding my wife. She has been with me through thick and thin, and now I have found my purpose in by creating a structure. I'm a writer and a storyteller. So after coming out from the hospital, I engaged myself, and that I think to a huge extent helped me in the recovery process. But my wife is not able to get out of that syndrome. Though she has passions like gardening and music, and she's very good at them, she feels that every moment she devotes to something, to her passions, she is neglecting the family, particularly me. As a result, she's getting into some psychosomatic issues. So, what advice can we give to her that she shouldn't feel guilty if she's concentrating on herself? For her, that self care, that uh, involving in passions or in hobbies, which she needs to get out of this syndrome. How do I persuade her to get into that?
Very good question. We'll take it up after hearing a few more people. I'll come back to talk about that. Yeah.
Thank you, sir.
Sudeshji, would you like to come in and share your...
Okay. So, just a minute. Thank you very much. See, purpose can be multiple ways. And I think caregiving is, again, it differs from person to person the person himself or herself also, I can say. For example, today when we are talking about this intellectual disabilities, mental illness and all, I remember a very small incident from my own younger days. We had a family opposite to our house, and this girl was a bit different than others, but at that time we didn't have any name because I hardly myself was 13 years old or something, but I was used to looking after my mother who was diabetic. But it never occurred to me that she's a challenge for me, or how do I manage the time. So that is what I say. Even caregivers have their own personality, outlook, attitude, and skills, which can be acquired. And these are some of the things which may be the innate things also. So what about this incident is, I have this habit, if I see someone, somehow the other, I will smile. So this is what I used to do. And these were the old houses when you have a boundary wall and the single story houses on both sides, something like that. And then one day this girl was sitting at the chest of her father and choking him. That day only we realized that all neighbors are looking at, and somehow the other, I felt very uncomfortable. I jumped over the wall, went to that girl, tried to just smile back, and all. Somehow the other she connected, and slowly. And later on we find that she's a mental illness person, but we didn't know at that stage. So I feel that when we say about the purpose in life, sometimes our circumstances create that. So when I had cancer and I was trying to recover after my first chemo, my first question to the doctors was, when can I go for my work? And because, as I tell Dr. Murthy many times, I'm not a person who will be in that, say, in that sense, we'll say it is spirituality, though I believe in the Almighty, in that natural power, but I'm not a person with this thing. But for me, working in all my waking hours for the persons with disability, that is my chosen field since 1983. And now even at nearing about 80, I continue to do that. So I'm really thankful to Mr. Aditya and Murthy sir for giving me this time. And I wanted to offer to Mr. Aditya, Manu Punjabi bhi aandi hai. I'm from Punjab basically, Jalandhar Bisharpur side ki hu. So if you need any time to help you with the documentation or any such thing, sir, that is what my purpose in life is, to keep myself healthy and also to serve whomsoever I can. So I will just stop it.
Thank you. Saraswati, your...
Thank you
Saraswati
so
heads
much,
the
Dr.
Mumbai.
Suresh. We'll certainly take your offer. Thank you so much.
Murthy Sahib knows, and most of the people in Chandigarh also know. So,
Go ahead, Saraswati.
Yeah,
Yes, Ms.
thank
Saraswati.
you. Thank you, Dr. Murthy, for giving me this opportunity. So I'm a caregiver for my eldest son who's been diagnosed with schizophrenia. And we have been in this journey for the last 10 years plus. And I would say my journey in the last 10 years has, I'll put it as a 3 phase, where the first phase was a anger, why my son? Why with us? Why do we have to go through all this? And then it led to frustration because we had to, to compromise with our careers. My husband had to move down from Singapore. I had to quit my job. So there's a lot of frustrations. Things changed, like Dr. Murthy said, is when acceptance happened. And that acceptance through family therapy helped us to it completely changed the paradigm at home, the environment at home. We created a very safe environment for my son, and the recovery process changed. More than that, I would say my son today, I'm so thankful to him that he has given me a purpose in life. Today, I founded FAVME, Family's Voice on Mental Illness, so a group of family carers, which is also the Western regional chapter of FACE India, founded by Dr. Srinivasa. And we're trying to do a lot of work on advocacy on mental illness. And through this journey, I'm being able to reach out to so many people. I'm being able to connect with so many people, like, attending such webinars and learning and also implementing them and also helping others in this journey. So I completely agree with Dr. Murthy that yes, the 10 things of self-care, giving that purpose in life, spirituality, all this plays a very important role. And that purpose in life is what keeps going. And I think that purpose in life is not only for a carer. I think it's equally important in any person in this world. So yes, it has made a difference in my life. Thank you.
Thank
I
you so
think
much, Saraswati ji. Thank you.
the question which Ramendra raised already, Saraswati has responded. In the sense, I think it's very important to recognize the same way that as a person with illness go through a phase of denial, acceptance, and finding a meaning, the family member has to do that. And one of the ways to do that is, as Saraswati said, getting help for the person independently rather than through the ill person. Saying that, look, you need to also, very often the model that we use it, Ramender, is the grief model. In the sense that there is a loss of someone. If I have a family member, there's a very famous story called Welcome to Holland to describe this one. Someone who wanted to go to Italy and settle down ended up in Holland. What happens? It's a beautiful story of one page and used in the model. So what we need to do is to allow the person to express the loss that they have experienced as the person they've married or they had as a child or whatever it is, or a brother or sister, and then find the meaning and purpose in the companionship, in the journey that they are making it. It is a process. It is not something which we can prescribe, saying that be nice to the person or something like that. Thank you very much. Dr. Bandari, you want to come in?
Thanks for your time. I think, first of all, it's been a pleasure listening to you. I must support you. I've worked in UK for the last 20 years. I think I'm very much happy to hear that the sort of my thoughts completely with yours. I think I completely agree with the points you make with regards to the familial support. So just to put in context, I work primarily as a neuropsychiatrist, and dementia is my kitty. I primarily see dementia. So you could expect somebody to be 85-year-old who has dementia. The carer burden is a thing. The wife would come with you, sometimes literally crying because this chap, the husband, in the evening becomes aggressive because he has dementia, and sundowning happening, this and that. So be it schizophrenia, be it dementia. I won't take much time, but briefly, I just want to raise 3 points over here, which more or less you covered. One was I think acknowledgement. So I always say carers are the hidden gems of a society, be it cancer carers, be it all the mental health carers, because the amount of unpaid work these guys do, I think without them, I don't think the mental health in any country, including UK or USA, wherever, much more resource heavy, much more resourceful countries, even there we cannot have. So just because today there was a article in the Hindu, it said we have 0.75 psychiatrists on 9,000 psychiatrists in entire India. We in UK have about every 1,000 we have a psychiatrist, much more. In spite of that, I have no degree of pride in saying that we are of little or no use except when we have carer support, a bit like the point you make, that have familial carer support. Number two, I think just to also say the point that I think it's the carers, why it's very important that taking the role, they should not stop their life. So in the audience, I've heard a few people saying how much they have actually given up or given everything in their life for the carer, for the patient, sorry. That's very good. But you know what? My suggestion to you is, this is my tip, this is something you already know. You have to look after your own self. As somebody said, she herself suffered mental health issues. It's a carer burden. It's a 24/7 job. It's a thankless job. Sometimes the patient, not that they don't mean to, but they cannot appreciate the support they're giving because they're just in that mental health phase. So all I say to everyone is, it is a job which has a purpose, very well said by many of you guys, but don't stop your life. To carry on with your own life as well, because this is an ongoing process for years and years. And the other issue we often have is sometimes when the work stops suddenly because your loved one is no more there, it can have a dramatic impact on your own life if you have no other purpose in your life. Because that becomes you. Who you are the person looking after the person. That person, sadly, if there's no one not there, your life should not stop. Because I don't want you to be also a patient one day. Nobody wants to be mentally unwell. So look after yourself as well. And you know what? Once in a while, pat you on the back, as you should. It's worth it. Thank you.
Thank you very much. Aditya, can we play the Arun Shoury's video? That will answer many of the things that have come up in the discussion. Also, way of ending it, unless someone else wants to come in and talk.
No, I want to come in. I've been just holding back. So thank you, Dr. Nick. You put it very articulately. Before I come in, I would request Dr. Kalyan Sundaram. Dr. Kalyan Sundaram, if you have any input, suggestions, questions, please, sir.
Thank you, Aditya, for organizing this and asking me. As usual, it was good listening to you, Murthy. Murthy and I go back just a little over 5 decades of professional relationship and friendship. I just want to make a couple of points. However much a professional can talk about how good it is to caregive, how do we go about providing care for the people with mental illness and supporting them. But when you are a caregiver yourself as yourself, and it is not very easy to practice what you preach. I'm talking about myself. I've been in the profession for more than 50 plus years, like Srinivasa Murthy. And I had my own sister, my only sister, who suffered from schizophrenia, and he passed away when she was only 36 years old. I've gone through providing caregiving to her because she used to come to Bangalore. She lived in Ooty for treatment, and she used to live with me. And it was not easy at all. So however well we talk about providing care, but when you actually do that, it's a very tough task. And providing care, more often than not, it's a one-way traffic because the returns are not very satisfactory to yourself. But as Dr. Nick said, I think it's very important to take care of oneself and not delve deep into caregiving at the expense of one's own health. And that's very important. If there's an opportunity to share caregiving with other members of the family, try and do that. Because caregiving, as Murthy said, does not come easily and naturally to all. Either you have a penchant and you have a temperament to provide care, not all family members are able to do that. But I also agree with what Srinivasa Murthy said, which I normally share with my students. Caregiving is a journey, it's not an end point. and you do not know where the destination is. But plowing along, taking care of yourself, providing the best support that is possible to do that, I think they are the keys. Experiencing as a caregiver is not easy, same as providing information about caregiving. I would like to share this little few points. Thanks, Murthy. Thanks, Aditya, for, as always, coming out with a wonderful program, getting the best of people available in the country to give this information and share it. Thank you.
Thank you so much.
Before Aditya takes over, I just want to make one request to everyone. You know, one of the biggest challenges we have, as I said, the first book that came up was in 2008, Sepia Leaves. We need to have hundreds of stories of people living as well as caring for the persons with mental illness. I have made my life purpose to bring out such a book of hundreds of stories of India, different from different backgrounds, educational backgrounds, income backgrounds, different religions, so that when I have a family member with a mental illness or I am myself mentally ill, I have a book like Amrit Bakshi's book, which I can read and say, hey, I can also overcome this one. That's what we did with the mentally retarded in this book. So I offer to any one of you, all of you rather, to let's put our heads together, contribute, work together to bring out Indian way of caregiving and living with mental illness. Both as Ramender said, he talks about his own illness and other things. Let's talk about it, normalize it rather than the deviancy model. Thank you very much, Aditya. I hand it back to you.
Thank you, Dr. Murthy. And I am so happy with the participation. Taking from what you just said, I think there is still a paucity of stories, still a shortage of stories from
Absolutely.
Different states, different villages, human being, man is essentially a storytelling animal. And it's been our struggle the last 5 years, Citizens for Inclusive Living Society. Uh, at the end of my 5 year struggle, I don't hesitate to say that dealing with government officials have been less of a struggle, even though they ignored us initially. Getting the families out of their shell, and even more importantly, getting the persons with mental illness out of their shell has been our biggest challenge. Asking them to share their stories, asking them to come out, asking them to fight for their rights, asking them to make peer support groups. 90% of them still in their shell. So yes, I agree with you. There is a huge shortage, a paucity of stories, and stories are liberating both for the storyteller as well as the other families, the other people who are in the same boat. The second observation I would like to make is that yes, and India, more modern society now, especially in the cities, we are nuclear families. A nuclear family is also perhaps too small an institution to deal with it. As the saying goes, it takes a village to bring up a child, but it certainly takes a village and a larger community to take care of someone with mental illness or intellectual disability. Sometimes the toll on the spouse or the parents or the single parent is just humongous. As Dr. Nick said, one, it's a thankless job, it's a 24/7, 365 job. I mean, just a spouse or just a single parent or two parents, too small an institution to deal with it. So yes, the large family system, the extended family system is breaking down, although it's still there in the villages. So how do we envision or visualize larger communities? The next logical step to my mind would be peer support groups or these families forming a group. And in some sense, the government supporting it and different kinds of support, acknowledging those groups, maybe financially supporting them. All of our discussion, one, of course, the talk is in English, or even in our peer support groups, we are only able to reach out to the middle class, at best to a few lower middle class families. My heart goes out to the economically weaker section. It's a double whammy for them. When we talk of finding purpose in caregiving, I can relate to it. And for families for whom bread and butter is not an issue, perhaps using their spiritual resources, perhaps a certain bent of mind, they may still be able to find a purpose. But Dr. Murthy, what do I tell someone, a laborer, a rickshaw puller, the economically weaker section, who doesn't have money to put food on the table, and this is burden number 2 or burden number 3? I mean, I'm just at a loss when I face them. And we have a few families, such families in our group, but they slowly either don't come for the meetings because some of our discussion is in English and they are unable to relate to. But even more importantly, I feel so bad and guilty that I have nothing to offer to them. But yes, what I have been able to do and will continue to do is to fight for their rights. And in the group home that's coming up in Chandigarh, we are trying to make sure that the seats for economically weaker section are also reserved at no fees, no financial burden to them. But in terms of finding the larger purpose, I'm at a complete loss. I see Shubh has raised his hand, and then Dr. Murthy, I would request you if you could shed some light on this.
Yeah.
Yes, Mr. Miss Shubh, if you would like to come in.
Yeah, hello, sir. Thank you. I would just like to comment that what you have said. Like, I'm from a lower, I used to be from a lower middle class family. Now I'm from an upper middle class family due to my marriage. But I still take care of my sister who is now in a home because I cannot keep her with me. Now I'll go very fast because like 10 years, for 10 years, I took care of her. I took her to Ibhas. In Ibhas, I just came across with so many lower class families, and I saw them, they are more united than middle class families. Like in Delhi, no organization is concerned about how middle class family is paying from their own pocket. Like I have to work a whole life to be able to pay for her. But in the lower class family, they are very united, and it's a really good point that you have raised. I am tremendously, inspired by them, because I saw that इतिहास में वो लोग कैसे अपना खाना लेके आते हैं, सब आपस में बांटते हैं. मुझे उनसे बात करके भी इतना अच्छा लगा था कि I really felt in love with the lower class family, like rickshaw pullers and all. And I don't feel like, I have to, find a purpose in life. Like, what is their purpose in life? How they are doing it? And I really feel, um, आई डोंट नो, आई डोंट हैव एनी वर्ड, बिकॉज उनके पास लाइफ है तो उनको जीना है, एंड उनके पास ऐसा बच्चा है तो फिर उनको देखना है. एंड रियली आई ट्राई टू फाइंड सम स्पिरिचुअल पर्पस, and whenever I try to do some meditation, etc., and after that I think of Vibhas, I think of all those families, and it really encourages me. Thank you.
The situation in India is so complex. For example, you just take the example of disability support. I don't want to use the word pension support. It ranges from 300 rupees per month in some states to 6,000 rupees in another state in India. Just imagine a 20-fold difference. 6,000 is in Andhra Pradesh, while 300 is in Orissa and Bihar, if I remember right. Recently, I saw a list of all the benefits in that, while 3,000 is in Pondicherry. To answer to respond to the question, the mental health care in India has gone through closing, not moving away from the hospital, mental hospitals to general hospital to the community. That's one of the things which we did in Chandigarh and all going on. Now it's gone to Telemana, that's making it accessible to people. What we really have not done, Aditya, the group of people we are talking about, what is it that will make a difference to them? Like Chavan started this home care program, which made a tremendous difference. That you did not expect the person to come to you, but you went to them and made it possible for them to take the treatment. Similarly, if the caregiving is a total time taking their full time, giving an allowance, already luckily one state, I just read about it in the newspaper, so I'm not publicizing it because I have not had any personal example. They are giving 1,000 rupees as a caregiver allowance to begin with. For example, in California, you have 3 months of paid leave if you are a caregiver. So there's a whole lot of things that needs to be done. And I know that recently the home care has been started by NIMHANS. So we need to explore all of these things to see which of these needs can be fulfilled by which of these activities, rather than saying that like today's Hindu, which Dr. Bandari referred to, we are talking about numbers are increasing, but the services are not enough. Services will never be enough. For example, America has got 100 times more resources. Still 50% of the mentally ill are not coming into care program. We need to be innovative. We have to empower the individuals. We have to strengthen the family. We have to strengthen the community, and also have innovative programs to meet those people who are at risk of missing out from the care programs. And of all these things, the most important thing is that we need to write what is it happening in our country through stories and by forming pressure groups like Aditya has done it. You know, I just want to say Aditya has experienced the caregiving in a very personal manner and used it to bring about a tremendous change in Chandigarh. I feel really so proud of the things. Thank you very much.
Thank you so much, Dr. Murthy, for your kind words. But I would remind you that it's a joint effort of the citizens, and my esteemed colleague, Dr. Bhupenderjeet Vadach, Dr. Simi Vadach is here. She's been a pillar of support right since the beginning. I would also request Dr. Vadach if she would like to say something. She's currently traveling, I think, driving to Patiala. So she said she will try and connect even on the way. Dr. Simi Vadach, if you could hear us, if you want to join, if you want to say something. Okay, she might be driving. She had said that she'll be driving to Patiala. So maybe sort of the connection on the way. Dr. Sudesh has raised her hand again. Dr. Sudesh, please go ahead.
I just wanted to share some information that whatever, say just now we are talking about the mental illness. So now we need to be very careful, because after the Right to Persons with Disability Act, which also covers this particular area also, now they have declared that this is a state subject. So Dr. Murthy was just now referring to the variation, the type of pension people are getting across the states. So, sir, we will need to look at the government, try to get whatever we can get out of that. Again, we will also have to gear up our own efforts at the ground levels nearer to wherever people are located. Because if we depend on, if we don't have that type of multiple approach, we will not be able to reach out to the people. And the new guidelines, which have been very recently published, they have now given a greater role to the psychiatrists in the thing, which earlier was not there, to the psychologists also. But then again, जैसे कि अभी भी इस फोरम में भी होता है, हर फोरम में होता है, हमारे जो पार्टिसिपेंट्स होते हैं वो बहुत सारी भाषाओं वाले होते हैं, अलग अलग भाषाओं वाले, और हम लोग जब बात करते हैं तो हम लोग इतना टेक्निकल हो जाते हैं, इस लेवल तक अगर वो ज्वाइन भी करते हैं हमारे ग्रुप्स, तो हमारी बात उनको समझ में नहीं आती है. तो शायद आदित्य, इसीलिए मैं ये वाली बात आपसे ऑफर कर रही थी कि हम लोगों को जहाँ पे भी हम काम कर रहे हैं, हमें इन बातों पे भी ध्यान देना होगा. अभी मैंने पटना में थोड़ा सा कुछ काम किया है इस लेवल पे, और वहाँ पे यही देखा है कि पेरेंट्स ही या फैमिलीज ही मेजर केयर गिवर के रूप में आती हैं, वही लेके जाती हैं. बट बहुत सारी फैमिलीज में क्या होता है, इट बिकम्स अ लूजिंग अ फुल डेज जॉब. लोगों की पूरे दिन की तनख्वाह चली जाती है ना. तमिलनाडु में भी मैंने इस तरह का काम देखा है, जहाँ पे प्राइमरी हेल्थ सेंटर के साथ में ही माँ बाप को भी ट्रेनिंग दी जाती है कि उस बच्चे को कैसे करके संभालेंगे. बट अगेन इट मीन्स कि फैमिली को बहुत दूर से ट्रेवल करके आना होता है. तो इसलिए मुझे लगता है कि हमें गवर्नमेंट वो सब चीजें भी कोशिश करनी पड़ेंगी. उसके साथ साथ पहले CSSR से हम लोग को बहुत सारे फंड्स मिल जाते थे, अब धीरे धीरे वो भी थोड़े मुश्किल होते चले जा रहे हैं. सो जैसे हम लोग एक और ग्रुप में काम करते हैं, जिसे हम टैलेंटेड बच्चे जो है उनको पढ़ाई में मदद करते हैं. लेकिन एक अप्रोच जो हम लोग कर पाए हैं अपने लेवल के ऊपर, जिसे हम कहते हैं पर्सनल सोशल रिस्पॉन्सिबिलिटी. अ ग्रुप ऑफ अस, we contribute some money, and from there we are supporting these children. So it may be nominal at the beginning stage, लेकिन ये वाले efforts जो है hand holding का काम करते हैं. So especially means I thought I will come up at this point to these type of points कि जब हम family को as a caregiver देखते हैं, उनका purpose और उस पर्पस को और आगे बढ़ाने के लिए, उनको एक फोकस देने के लिए, करने के लिए शायद हमारे जैसे लोग जो है वो भी करेंगे. हमें एज एक पूरे स्पेक्ट्रम पर अपना देखना पड़ेगा कि हम किसी भी गिवन एरिया के अंदर कैसे कितने लोगों तक पहुंच सकते हैं. सो आई जस्ट वांटेड टू शेयर दैट, क्योंकि मैं बहुत ज्यादा इस फील्ड में नीचे वाले लेवल पे भी इन्वॉल्व रहती हूँ अलॉन्ग विद द पॉलिसी. तो मुझे कई बार ये सब चीजें थोड़ा चिंता भी करती हैं और कहीं कहीं इंकरेजमेंट भी मिल जाता है, कोई रास्ता भी हम निकालते हैं. थैंक्स यू फॉर अगेन.
Thank you.
Thank you so much, Dr. Sudesh. Thank you so much. Dr. Murthy, I'll be remiss if I don't acknowledge my colleague and right hand for 4 years, Gurpreet Singh. Gurpreet Singh is a psychiatric social worker. Recently, he
Hello,
joined.
Gurpreet.
Hello, sir.
Recently, he joined PGI. So our loss has been PGI's gain. And I am now on the lookout for an equally capable psychiatric social worker. But on the point of purpose, I forgot to mention, Dr. Murthy. So for persons with mental illness, we've had peer support groups for the last 4 years and also family support groups. And one of the things we discovered is that some sort of art and craft is a huge stress buster. Plus, so we had a volunteer, a young arts graduate, and now she's gone to Australia to pursue art therapy. I'm not sure if she's here, Jashan. She conducts online art sessions, and people, the 6 or 7 participants who attend it regularly find such joy in that, so at times it's a little difficult to manage Australia time with India time, but we're trying to do it. So weekly art sessions, and mostly for persons with mental illness, but sometimes for the caregivers as well. And the few families who join in have found it very, very therapeutic. And I was very happy to learn from a couple of ladies participants, that this is a joy and a purpose to our life.
Absolutely.
So
Absolutely.
I find art and crafts and music or nature walks a huge, huge, and something that's available to most people, doesn't come at much of a cost. We are open for questions. If anyone has a question or comment, please feel free to. And if not, then as Dr. Murthy has requested, there's a second video of Arun Shori. Dr. Murthy, would you like me to play that video?
Yeah, I think that will be a good ending with that. Why don't you finish the vote of thanks and you show the video and close it?
All right.
Nothing can be said better than Arun Shori saying it. Everything that we have wanted is being said.
Right.
Unfortunately, when you played Amitabh Bachchan, only the sound came. I hope we can get the video also this time.
Oh, I am so sorry. I did my rehearsal 3-4 times, and I am so sorry.
I know. We tried it very much. I hope. Even if it is the audio also, it's worth it. He makes such a fantastic... his son has cerebral palsy for 40 years. Wife has severe Parkinsonism. And Arun Shori is such a fantastic person. He has written a beautiful book. Does my son know his mother's heart? It's a fantastic book about suffering and religion. Go ahead.
And I would also type in the email address of Citizens for Inclusive Living Society. We have a website, and there's also a Pushpanjali Trust website. So the resources will be shared. But in case you're looking for something specific, you can also drop us an email. And I'll type in that. And thank you so much, Dr. Murthy. It's been an honor and a privilege. And Dr. Murthy has also shared his email address. He's happy to answer questions. He's also happy to talk to people by phone between 5 to 6 p.m. But please send him an email first and explain your purpose. And then Dr. Murthy has kindly agreed to make himself available during that time. Very generous of you, Dr. Murthy. So thank you so much, sir. Thank you for the session.
I'm trying to find purpose with my life.
It's
Go ahead.
mutual. It's mutual, you know.
Mutual.
So
Thank you. Thank you.
yes. मैं share पहला कर दूं.
Well, actually, I am the sort of servant in chief of our son and of my wife.
Can you see
Both
the
of them
video and
require
audio?
help, and we are fortunate enough that we have.
No, we can hear, but we cannot see
They require
the video.
help all the
Can't
time.
see the video?
And
It's
I
not
am
coming. Maybe you have to go to hyperlink and play it.
and certainly that has a great effect on one's life.
Now we can see it now.
You can see it now?
Play it now. We can see it.
That to transmute, to convert suffering into service is one of the methods of therapy
Sound
which I have seen demonstrate, I have experienced. To such an extent, as Mother Teresa would say, love till it hurts. We did not know. And I've well, no, we were in Washington. We did not know what it meant that he has a brain injury and what will be the consequence. And I remember a wonderful old man, Dr. Kennedy. He was the head of this neuroscience thing at the Georgetown University Hospital, where our son was born in Washington. And he's an elderly man. And when we were on the second or third day told by a Pakistani doctor that your son has had brain injury, but don't let anybody know that I told you, because I will be out of a job. And whatever had happened. So by that time I had resigned from the World Bank to come back to India because there was the emergency. I very much wanted to be here for a long time, certainly at that time. So we had gone to Dr. Kennedy and I asked him, sir, I have resigned my job, and but if you feel that for the sake of the child we should remain here, I will try and get a job back and continue here. And he gave us advice, which was among the most precious pieces of advice I received in my life. He said, you know, young man, I have not been to your country, but I hear that your families are very close. And it is that net of love and security which this child will require as he grows up. And that turned out to be the case. This was our parents' house. We lived with them. My mother-in-law gave up her own entire life and came and stayed with us for 25 years. And it was only because of them that we survived. And our child grew up. He's 42 now. And he has grown up in the fullest confidence that his word is the law. He is the king. And to such an extent that, as you saw in the book, I don't know if you were there in the book, so he blessed the Dalai Lama. Yeah. So we have, those photographs have become sort of for us treasures of the family. Difficulties increase, as our difficulties increase, it becomes very difficult now. Neither of us knows what will happen tomorrow and who will look after our son. That's the worry of every person with a handicapped child. And I may die tomorrow, and then Anita will require 24 hours help to look after herself and our son. And today she cannot sign a check. So we've had to set up a trust so that her sisters and her brother and Mrs. Bimal Jalan, her closest friend, they can then operate all our savings on behalf of my wife and their child. So these special problems are arising now as we age. Life, his difficulties certainly endow one with a sense of proportion. Supposing somebody abuses me on this damn fool Twitter or social network, how does it matter? Supposing I'm dismissed from my job in the Indian Express and I feel that my tongue has been pulled away, but I see my son, he can't even speak. So I get a sense of proportion. I think one is to serve them unconditionally. Do not sit, service must be non-judgmental. Because the mind gives us so many reasons for not serving. You should recognize them that they are excuses which the mind is manufacturing. And therefore it will be best for us to not judge, but just serve. There's a very good sentence of the Dalai Lama. If you want to be truly selfish, help someone.
What a line.
Beautiful line. So I have added a footnote to that. That is, if you want to be truly selfish, help someone who cannot do anything in return to you, for you. You see, if you help some big fellow, some businessman or prime minister or some fellow, but when you serve a child who cannot do anything for you, or when you give an anonymous donation, then there is no way when you can expect anything in return. Then service has truly a therapeutic effect.
I just want to take a...
Yes, please go ahead.
I just want to show this book as the first 30 pages describes Arun Shoury's journey with this son. It's one of, not one, the best caregiver article, the writing that I have seen it. Please do look it up, or write to me and I'll send you a copy of the chapter. Thank you very much. Thank you, Aditya. It's been a wonderful evening.